Bonjour tout le monde.
Hello, everyone.
Happy to be here today with Minister Hussein, Minister Leblanc, and Dr. New. I'd like to start by thanking all the candidates, volunteers, election workers, and most importantly, the tens of thousands of voters who participated in by-elections both in Toronto Centre and York Centre. Yesterday shows that even during a pandemic, Canadians believe in the strength of our democratic institutions. I'd also like, obviously, to congratulate Marcy Ian and Yara Sachs on being elected as the new Liberal Members of Parliament for Toronto Centre and York Centre. Through her over 3 decades of work as an award-winning journalist, Marcy brings a passion for advocating for vulnerable communities. And as a successful small business owner, Yara has first-hand experience of what our businesses are facing during this pandemic. Both Marcy and Yara are dedicated, progressive community advocates who are committed to making the lives of the people in Toronto Centre and York Centre even better. We look forward to having both these strong women join our progressive team as we work to support our communities and to build back better. Over the past few days, we've seen record cases of COVID-19 across the country, and it's a cause for concern. Behind each new number is a friend, a parent, a neighbor, or a senior. People's lives are at stake, and we all need to do our part. So follow your local public health guidelines, wear a mask and keep a safe 2-meter distance from one another, and download the COVID Alert app. It's easy, it's free, and with over 4.8 million downloads, it'll help you do your part to protect your friends and loved ones. Together, we will get through this. Au cours des derniers jours, nous avons enregistré.
Over the past few days, there have been record numbers of cases of COVID-19 across the country. This is cause for concern. We must take this situation seriously. Behind each number is a parent, a friend, a neighbor, or a senior. There are lives at stake here. So, we must all do our part. Please continue to follow local health guidelines, wear a mask, keep a safe distance from others, and download the COVID Alert app.
Many folks have found themselves working from home, and in cases where they've needed to self-isolate, most Canadians have been able to do so because they have a roof over their heads. But imagine if you didn't have a home, especially during a Canadian winter. Sadly, that's the reality for far too many Canadians, and our government is taking action to change that. Since 2015, we've created a national strategy for affordable housing for over 1 million people. We took this issue seriously since forming government, and now that the pandemic has made housing needs more acute, we're stepping up again. Last month, Minister Hussein announced an investment of $1 billion for the new Rapid Housing Initiative. The goal of the program is to give the most vulnerable a safe place to live by quickly creating up to 3,000 new affordable housing units. Today, I can share more details about how this funding will be used. The Rapid Housing Initiative will be equally split between the major cities stream and the projects stream. Right now, our largest cities face a growing need for safe and affordable housing. We're investing $500 million for immediate support to build long-term housing for municipalities that have the highest demand. We've also opened up applications for the second half of funding through the projects stream. Today's announcement is part of our commitment to eliminate chronic homelessness in Canada, as we announced in the throne speech, while also creating good jobs in the housing and construction sectors. Aujourd'hui, j'annonce que...
Today, I am announcing our $1 billion investment to create safe, affordable housing. This is the Rapid Housing Initiative, which will have 2 funding streams, the Major Cities Stream and the Project Stream. Right now, Canada's largest cities are facing growing need for safe, affordable housing. We are thus investing $500 million for immediate support for municipalities with the highest housing demands. The second funding stream, the other $500 million, will be for the projects stream. These projects can be led by nonprofit organizations, indigenous governing bodies and organizations, provinces, territories, and municipalities. This is part of the Liberal Party's commitment to end homelessness, as we announced in our speech from the throne. At the same time, we will be creating good jobs in the construction and housing sectors.
Second wave of this pandemic. That comes with new challenges for small business owners. And as I told the Canadian Chamber of Commerce yesterday, we're stepping up to help, as we have since day one. Earlier this month, we announced that we would strengthen the programs that have been a lifeline for small businesses by introducing an extended wage subsidy, which covers up to 65% of eligible wages. Business owners like Steve and Cami of Steve's Poke Bar in BC will be able to keep their employees on the payroll. For support on rent, the new Canada Emergency Rent Subsidy will go directly to businesses, not to landlords. And those who have to close temporarily because of a local public health order will be eligible for an additional 25% support. That brings the total of 90% of rent covered for the hardest hit businesses. And to help cover other costs, we've expanded the eligibility for the Canada Emergency Business Account while increasing the total amount to $60,000. Depuis hier, les entreprises.
Since as of yesterday, all businesses with personal banking accounts will now have access to the Canada Emergency Business Account. They can access it by opening a business banking account with a participating financial institution. As for our other supports, such as the Canada Emergency Rent Subsidy and the Canada Emergency Wage Subsidy, and the changes we have brought to those, we will be tabling a bill soon, and we hope that MPs of all parties will support these crucial measures.
By taking a moment to recognize all of the women and men across the country who keep Canadians fed. Our government is here to support them just like we have been since the start of the pandemic. Today, Minister Bibeau will outline how people in BC can apply for the Emergency On-Farm Support Fund. People in other provinces will also be able to apply soon. Le Fonds d'urgence pour les mesures de soutien à la famille.
Today, a $35 million Emergency On-Farm Support Fund will be paid out to help agricultural workers throughout the country. Minister Bibeau will outline the details of this later today. We will continue to do all that we can to protect and help those who are working hard to feed Canadian families. Thank you very much, and we will now hear from Minister Hussen. Thank you, Prime Minister. I would like to begin by acknowledging that we are meeting on the unceded traditional territory of the Anishinaabe Algonquin peoples. As the Prime Minister said, Canada's major cities have been hit by the devastating repercussions of chronic homelessness and housing needs.
And worsened an existing problem. Now more than ever before, we have to ensure that our government's new rapid housing initiative is doing exactly that, and it is an urgent response backed by a significant federal investment of over $1 billion. Our team at the Canada Mortgage and Housing Corporation is ready to get funding out the door very quickly through two separate streams, as the Prime Minister has mentioned. First, the major cities stream. This is meant to go immediately in the next number of days, to cities that need it the most. This means the cities with the highest levels of renters who are in most need of housing, as well as the largest number of Canadians experiencing homelessness in these communities. So at this point, I want to thank Carol Saab and all of her teammates at the Federation of Canadian Municipalities who were instrumental in helping us arrive at this final list. And the cities that we're targeting are Quebec City, London, Waterloo, Halifax, Hamilton, Winnipeg, Victoria, Surrey, Edmonton, Calgary, Peel, Ottawa, Vancouver, Montreal, and Toronto. I spoke to the mayors of these 15 cities a few days ago. They're fully on board with our plan, and they're committed to turning this significant federal investment rapidly into housing for vulnerable Canadians. The second stream of the Rapid Housing Initiative also includes $500 million in funding. It will support specific projects brought forward by Indigenous governing bodies, organizations, nonprofit organizations, other municipalities, provinces, and territories. CMHC will be accepting project applications till December 31st, and all applications will be assessed within 30 days so that work can get started right away. These are partners that we've already worked with in the past, and we have no doubt that they will be able to mobilize quickly and harness this significant federal money to turn it into housing, to build modular housing, to convert existing properties into housing, and to purchase land for rapid housing construction. We will work together with our partners together and in the coming weeks, months, and years to build more housing for the most vulnerable Canadians so that they can be safe for now. And over to Dr. Noor.
Merci, thank you. Good afternoon, good morning. Bonjour à tous et à toutes.
Hello, good morning, everyone.
220,213 cases of COVID-19 in Canada, including 9,973 deaths. Nationally, there are close to 26,000 active cases across the country, based on the latest nationally, with just over 3% testing positive. Yesterday, a total of 4,109 cases were reported nationally. 1,686 of these cases were backlog cases from the weekend, and 2,027 were newly identified yesterday, excluding Alberta, which has not yet reported Monday cases nationally. This brings the average daily case count to almost 2,700 cases. There are also increased numbers of people experiencing severe illness. Over the past 7 days, there were on average almost 1,070 individuals with COVID-19 being treated in Canadian hospitals, including 224 in critical care, and an average of 28 deaths were reported each day. Il y a eu 220,213 cas de
There have been 220,213 cases of COVID-19 in Canada, including 9,973 deaths. Nationally, there are close to 26,000 active cases. Based on the latest national data, labs across Canada have tested an average of close to 75,000 people daily, with just over 3% testing positive. Yesterday, a total of 4,109 cases were reported nationally. 1,686 of these cases were backlogged cases from the weekend, and 2,027 cases were newly identified yesterday. This excludes Alberta, which has not yet reported Monday cases nationally. This brings the average daily case count to almost 2,700 cases. There is also an increased number of people experiencing severe illness. Over the past 7 days, there were on average almost 1,070 individuals with COVID-19 being treated in Canadian hospitals, including 224 individuals in critical care and an average of 28 deaths reported each day.
across Canada, there are many similarities when it comes to the factors that contribute to the spread of COVID-19. During the spring wave, the virus was our biggest challenge. There were many unknowns, including which public health measures were most effective to bring the infection rate down to manageable levels. Now we have much a better understanding of how the virus behaves. Our challenge now is in adapting our behavior to not give this virus any opportunity to spread. Bien que la situation liée à la pandémie
Though the pandemic continues to play out differently across Canada, there are many similarities when it comes to the factors that contribute to the spread of COVID-19. During the spring wave of COVID-19, the virus was our biggest challenge. There were many unknowns, including what public health measures were most effective to bring the infection rate down to manageable levels. Now, we have a much better understanding of how the virus behaves and spreads. Our challenge now is in adapting our behavior to not give this virus any opportunity to spread.
There are outbreaks in settings like long-term care homes and other group living, working, and learning environments. Public health is focused on detecting these outbreaks so they can act quickly to control the spread. But these are not the only settings where COVID-19 is spreading. Community spread from everyday activities to smaller and larger organized social gatherings is contributing to the caseload in municipalities across Canada. Let's remember that the lower the level of disease activity in the community, the lower the risk of outbreaks in closed settings. Dans les nombreux secteurs où la COVID
In the many areas where COVID-19 is resurging, there are outbreaks in settings like long-term care homes and other group living, working, and learning environments. Public health is focused on detecting these outbreaks so they can act quickly to control the spread. However, these are not the only settings where COVID-19 is spreading. Community spread from everyday activities to smaller and larger organized social gatherings is contributing to the caseload in municipalities across Canada. Let's remember that the lower the level of disease activity in the community, the lower the risk of outbreaks in close settings. Dr. Tam and I have also said that cases reported today are a reflection of exposures and infections that occurred up to 2 weeks ago. In some areas, we are learning that gatherings during the Thanksgiving weekend did contribute to the elevated case counts we are seeing today. Our actions matter.
The solution is simple. Implementing it is difficult, but the choice is clear. We must consistently maintain effective public health measures, stay home if we have symptoms, even mild ones, wash our hands frequently, maintain physical distancing, and wear a mask as appropriate. Letting down our guard and letting this virus win is not an option. La solution est simple.
The solution is simple. Implementing it is difficult, but the choice is clear. We must consistently maintain effective public health measures. We must stay home if we have symptoms, even mild ones. We must wash our hands frequently. We must maintain physical distancing, and we must wear a mask as appropriate. Letting down our guard and letting this virus win is not an option. Thank you.
Thank you, Dr. New. The Prime Minister will be available to answer questions for 20 minutes. Ministers and doctors will remain available for 20 minutes afterward. Merci beaucoup, Dr. New. Le Premier ministre répondra.
Thank you, Dr. New. The Prime Minister will be available to answer questions for 20 minutes, and then there will be a further 20 minutes of questions for ministers and doctors. We will start with questions on the phone line. Operator, over to you. Thank you. First question.
The Globe and Mail, line open.
Good afternoon. Prime Minister, you clearly have continued confidence in RCMP Commissioner Brenda Lucki, but one of your own cabinet ministers says he disagrees with her assessment of the RCMP's response to violence faced by Mi'kmaq in Nova Scotia. So what concrete...
Christy, I think we lost you here. Would you repeat the question?
Just un petit moment. Ms. Kirkup, line open again.
Hello, can you hear me? Hello, can you hear me?
We can hear you.
Yes, go ahead again.
Okay. Thank you for your patience. Prime Minister, you clearly have continued confidence in RCMP Commissioner Brenda Lucki, but one of your own cabinet ministers disagrees with her assessment of the RCMP's response to violence faced by Mi'kmaq in Nova Scotia. What concrete evidence do you have from the RCMP and from the Commissioner that the force is willing and able to look within to address systemic racism in the force?
I think we all recognize that over the past months, years, and decades, our systems have consistently failed to adequately protect and support Indigenous peoples and racialized Canadians. And the RCMP has certainly been part of that. We need to do better. We need to pledge every day to work with Indigenous communities, with racialized Canadians, and with all Canadians to reduce systemic racism. We will continue to work with the Commissioner, with the members of the RCMP, and with all institutions that serve Canadians to reduce systemic discrimination and racism throughout our country.
Following up, Christine?
And Indigenous experts, Prime Minister, say the Correctional Service of Canada cannot be trusted to tackle the impacts of systemic racism, including the greater number of racialized Canadians who are institutionalized. What specific steps will your government take to hold the CSC accountable?
I think addressing systemic racism requires us to hold all institutions accountable and recognize that every institution has changes to make and improvements to in order to serve all Canadians fairly and properly, particularly racialized and Indigenous Canadians. But we know that the process whereby Indigenous or racialized Canadians go through the justice system and end up in our correctional facilities is also part of the challenge. So yes, we have to improve the work we do within Corrections Canada to fight systemic discrimination and racism within their processes, but we also have to go upstream into the justice system and even further up to community supports and investments that give people better opportunities than currently exist within our system that needs to be fixed.
Merci. Opérateur, prochaine question au téléphone.
Thank you, operator. Next question on the phone line.
C'est une question, Hélène.
Next question, Hélène Buzetti. Question. Hello, Prime Minister. What are your views on what occurred in France, the decapitation of Samuel Paty? As you know, Emmanuel Macron is facing a lot of boycotts and upset from within the Muslim community. Do you support him? Answer. Prime Minister Trudeau. First, we have and will continue to show solidarity with France in the wake of this terrorist attack. The murder, the decapitation of Samuel Paty is absolutely unacceptable, inexplicable. We condemn this act and we are absolutely in solidarity with our allies in France. That said, the current situation is that tensions are rising, things are becoming very heated, and we must listen actively, but also remain calm in order to prevent further escalation of tensions and conflict in the world. This is why I will take this opportunity to speak to many leaders, community leaders, world leaders, and also Muslim community leaders here in Canada. I will meet with them and listen to their concerns. In the current context, there's a lot of anxiety and tension already related to the pandemic, and we should not have anything exacerbating anxiety and tension.
As we have and as we will continue to do, we strongly condemn the heinous terrorist attack, the murder of Samuel Paty, which was unacceptable and absolutely unjustifiable. We will continue to stand with France as it reels from this terrorist attack on an individual and on shared values. In anger around the world that need to be countered, that need to be reduced, that need to be listened to and worked through. We're in a time of a global pandemic where anxiety is up, tensions are up, people are frustrated, people are fearful. We need to work together to work through our differences, to listen to each other, and to go beyond the frustrations that people are feeling. That's why I will be reaching out to fellow leaders, but also to leaders in various communities, including the Muslim community here in Canada, to talk about how they see the situation and foster greater understanding and listening.
Follow-up question. Prime Minister, am I to understand that you are somewhat criticizing President Macron, who often speaks of Muslim separatism? Also, what are your thoughts on the controversy at the University of Ottawa? A professor has been punished for using the very controversial N-word. What do you think of this situation? Answer, Prime Minister Trudeau. The attack in France was heinous, unacceptable, atrocious terrorism. And I think no parallel can be drawn between that situation and the situation at the University of Ottawa. We must always show solidarity with our allies. We must always stand up against all those who would attack our societies and our values. That is the fight against terrorism. And in that fight, we stand with our French allies.
Last question over the phone.
Thank you. Merci. Prochaine question, Catherine Lévesque.
Next question, Catherine Lévesque, La Presse Canadienne. Question. Hello, Prime Minister. I have a similar question about the controversy at the University of Ottawa. You have been asked questions about the controversy, and you do condemn racism, but what do you think more specifically about what has happened to Madame Lieutenant Deval? And what do you say to professors who say that they can't comfortably teach in a climate with such censorship? Do you think the actions taken have been acceptable? Answer, Prime Minister Trudeau. The fundamental duty of any teacher or professor is to teach, to transmit knowledge, to help students better understand themselves and the world around them. And that is not possible if those same teachers hurt their students, students who may already face discrimination and racism in their everyday lives, in the systems that they interact with, in their personal lives. We must hear, truly hear, those who are hurt by the use of this term, even if those who use it do not necessarily intend to cause harm. There are lessons to be learned from this event, lessons to be learned in academia, and lessons that are transferable elsewhere, especially lessons learned in understanding the everyday experience of some Canadians. Follow-up question. I have a question about today's announcement. How will $500 million truly help Canada's biggest cities build housing units? Your press office has said that you will build 300,000 new housing units.
This is a very dedicated fund for rapid housing. It is targeting the most vulnerable in our communities. It is not the only housing mechanism and funds available to municipalities, to communities. We have the National Housing Strategy, which communities and municipalities have been using to repair, revitalize, and build new housing. So this is in partnership with that. But I can tell you that this particular rapid housing initiative is targeting municipalities and communities that have been asking us to help them acquire distressed properties, convert them into rapid housing, and to enable them to also invest in innovations that can result in the construction of rapid housing in a matter of months and not years, and to also house people that they've been able to house temporarily through our federal Reaching Home program, to move them from that temporary housing into rapid housing. This rapid housing initiative will allow them to do exactly that.
Merci. On va maintenant passer dans la salle.
Thank you. And now, questions in the room. Hello, Louis Blouin from Radio Canada. Prime Minister, How do you explain the fact that you lost some support yesterday during both by-elections? Now, Annamie Paul, she did quite well, and the Conservatives also got some good numbers in these ridings. Is this a sign to you that you might have to change your strategy at some point? So how do you explain the loss of support yesterday? Answer, Prime Minister Trudeau. I am so proud to welcome two such strong women to our team in the House of Commons. These new MPs are replacing two male MPs, so this is yet another step, a positive step toward equity, gender equity in Parliament. By-elections are always interesting, especially in a pandemic context. I would like to thank all volunteers, all candidates, all those who participated in this election, all those who voted in these by-elections during COVID-19. This just goes to show how strong our institutions are. Our democracy is working well. I am so very glad to welcome these two incredible women, Marcy Ian and Yara Sachs, to Ottawa. They will help us continue the great work our government is doing.
The first thing is that I want to thank the volunteers, the candidates, the election workers, and all the voters who stepped up in this time of pandemic to participate in fundamental democratic exercise. We recognize that it's a particular situation. By-elections are always a challenge, even more so in a pandemic. But the tens of thousands of people who came out demonstrate that our democracy is strong despite the challenges that we may be facing. I also want to highlight that it is with tremendous pleasure that we welcome two strong women in Marcy Ian and Yara Sachs to their seats in the House of Commons to replace two seats vacated by men. So we're steadily moving towards a more gender equal parliament. But mostly I'm excited to have these two individuals who are strong, powerful, compassionate members of their communities stepping up to contribute to the work, the important work that all parliamentarians and this government are doing to deliver for Canadians through this pandemic.
Prime Minister Michael Couture with Global National. Through these press conferences, online ads, and even a televised address to the nation, you've tried to get through to Canadians to help them understand how important this is. Yet we still see house parties like the one in Chelsea, small town mayors that are begging not to have restrictions imposed to their communities. Your government promised a more targeted approach this time around, but more and more Canadians are already throwing up their hands in frustration with an even darker winter on the horizon. So what responsibility do you and your government take for the COVID-19 fatigue that so many Canadians seem to be experiencing?
We are in an unprecedented global pandemic, second wave. It's frustrating having shut down all of us, our lives through the spring, and now be forced to make more difficult choices and knowing that it's going to be a tough winter ahead as well. It's easy for us to want to throw up our hands. I think we have to ask ourselves who we really are as Canadians. Are we really good neighbors? Are we really people who care about the most vulnerable, about each other? I know we are. And it doesn't mean we're going to be perfect every step of the way, and it does mean we have to continually remind ourselves to follow public health advice. But I know Canadians can get through this together. And yes, we've seen rises in cases here and there. We've also seen flattening of the curve in other places. We know we can do this. We've done it before. And it's frustrating to have to explain to your kids in many parts of the country, like here in Ottawa, that we're not going to be trick-or-treating this weekend. And it's frustrating knowing that unless we're really, really careful, there may not be the kinds of family gatherings we want to have at Christmas. My 6-year-old asked me a few weeks ago, Dad, is COVID-19 forever? I mean, he's in grade 1. This was supposed to be his big year as a big boy, and they're not even singing in his classroom. This is really difficult. It's a time where we need to do the right thing. We need to lean on each other. We need to use all the tools we can. And we're not all always going to be perfect. And we're going to have to rely on extraordinary frontline health workers, rely on community supports, rely on a government that, as we've said from the beginning, will continue to be there to support people who need to stay home, to support businesses who have to close. It's the only way we get through this. But we will get through this. Vaccines will come, and they will be better than this winter. It's frustrating to have to go through this situation. Nobody wanted 2020 to be this way. But we do get to control how bad it gets by all of us doing our part, by provinces stepping up and making those tough decisions around who to close and where to close and when to close. Close where they need to. And all of us trying to deliver more tools to Canadians so that they can do their part. From masks to social distancing measures to an app that's already been downloaded almost 5 million times right across the country, that thousands of people have used to notify friends and strangers that they should probably get tested. This sucks. It really, really does. But we're going to get through it by doing what Canadians always do, by pulling together, by working hard, and by knowing that better days are coming. C'est plate, ce qu'on est.
This situation really sucks. We don't want to be here giving press conferences, wearing masks, and having to deliver news about increased case numbers in our long-term care homes, in our provinces, making announcements about further restrictions that are really annoying in our everyday lives. Nobody asked for this pandemic, nobody wanted it, but here it is. And we can't make it disappear overnight. But we can all do our part. We won't be perfect. We might slip up along the way. We might sometimes make the wrong decisions. But we must all do our best. That's how we will get through this. Provinces and territories are doing their part by enacting closures when necessary, by deciding on public health measures. And the federal government, as we have since the start, is supporting Canadians. We are here to support those who must stay home, to support our businesses, young people, families, seniors. We have sent in the Red Cross, the armed forces. We will do our part. We will increase PPE procurement. There is also a free app that you can download, the COVID Alert app, that can prevent breakouts. As Dr. New said, this time we understand the virus better and we know how to deal with it. And we will deal with it. We will get through this. Vaccines are around the corner. We will start receiving them maybe in a few months, but winter is coming. Flu season is coming. It will be tough, but we will get through it. How? By taking care of each other, by being there for each other, by doing our part. This pandemic won't be here forever. My son, Hadrian, a few weeks ago, he asked me, "Dad, is COVID here forever?" And I had a RCMP agent with me who sort of leaned in because he wanted to hear my answer to know what to tell his kids. No, COVID-19 won't be here forever, but it will be a while yet. Winter might be boring, unpleasant. Christmas is coming, and in many regions of the country, we might not be able to meet with our families to celebrate. Even if we do our best over the coming weeks. Spring is coming, though, followed by summer. Things will get better. We will work together. We will build back better, build a better, stronger Canada. We have protected our people, our citizens, our institutions, our businesses. And once we get this virus under control, we truly will come back stronger, build back better. Until then, we must do our share to get through this.
What responsibility do you think governments and public health agencies have in some of the mixed messages that Canadians seem to be receiving? I mean, you yourself said a few weeks ago, if you just don't get together for Thanksgiving, maybe we'll have a shot at Christmas. And I think I just heard you say, well, maybe we won't be able to have Christmas. You keep seeming to move the finish line, and the messages are often mixed. What responsibility do governments bear in that, and how can you fix that so Canadians are now getting a constant message?
I am, Mia, right now speaking to Canadians from one end of the country to the other. I have a responsibility as a federal leader to govern for all Canadians. And what we're seeing is situations that are very different in different parts of the country. Public health officials on the ground who know what is necessary in their community, what is needed in their community. So there is no one message we can give to everyone. Well, there was one message we could give to everyone in the spring. That was everyone stay home. Everyone don't go to work. Everyone lock down. And that worked in the spring as we flattened the curve. But now in this second wave, we have a better understanding of COVID-19. We have better tools to deal with COVID-19. And we can be a little more targeted. But yeah, that means a little more complicated in our messages. That some things we can do in some places that no, you can't do in other places. And it's frustrating to see, friends at the other end of the country doing things that you'd love to be able to do, but you can't. But that's why everyone needs to listen carefully to what their best local public health advice is. And that's why my advice consistently is listen to local public health advice, and the federal government will be there to support people right across the country, regardless of the situations, regardless of the advice and the restrictions that have to be brought in by public health. We could have a simple unified message, everybody stay home, but nobody wants that. So we have a more targeted approach that provinces are designing, that the federal government is there to support the provinces on. And yes, it's more complicated, but it's also far less difficult and painful for all of us as a country to be able to do it in a targeted way and not a universal way. Je pense que on a déjà eu un message extrêmement clair.
We had a clear one-size-fits-all message in the spring. The message was, everyone stay home, everyone locked down. It was a national lockdown, and that worked well in the spring. There was one message for everyone. Now, in the second wave, we have a better understanding of COVID-19. We understand where outbreaks are more likely to occur. We know how to reduce the risks of outbreaks, and we know how to take a more targeted approach, community by community. We do not have a one-size-fits-all message for all Canadians. It might be more complicated to have different advice for different regions, but it makes sense. My advice for Canadians has consistently been listen to local public health advice. And the federal government will continue to have your backs. We are here for small businesses, families, workers. Sometimes we make local shutdowns, localized. We make some sacrifices. But that is how we will weather the storm. We want to be able to recover quickly. and to build back even better. That's the commitment that we have made as the federal government, and we will continue to keep our promise to do everything we can for Canadians and to act in a targeted way to weather the storm.
With CTV National News. Yesterday, the procurement minister said that Canada could be at risk of not getting a vaccine in a timely manner if the Conservative opposition motion passed, which it did. Is your government alleging that big pharmaceutical companies will not sign billions of dollars in contracts simply because Parliament wants to review pandemic spending? And also, Canada is expected to hit about 10,000 deaths today. That's a very grim milestone. What do you think could have been done differently, and what do you say to the families who have lost someone to COVID?
What we are living through is a horrific national tragedy. Families have lost loved ones, been devastated by these tragedies, and we need to know that there are more tragedies to come. And we need to be there for each other, and we need to try and keep them as low and infrequent as possible with everything we know. But it's still going to be a very difficult time for many Canadians. Are there things we would have done differently? Absolutely. Every day we learn things about this virus. Every day we learn more about what works and what doesn't work. From the very beginning, we based our decisions on the best possible advice from the best possible experts we could find. But at the same time, obviously, we're learning that some things work better than others. And that's part of the process on how we make sure we're moving forward in the best possible way. In regards to the Conservatives' motion, it was expressed to us by a number of important private sector actors that there are concerns around competitiveness, around confidentiality of contracts, around things like that. And we're going to work, as we always do, to be as transparent as possible without putting at risk Canadians or their well-being. This is something that all Canadians expect of their government and of parliamentarians, and we will work with Parliament to try and ensure that we're getting as much information to them as possible, while at the same time not putting at risk Canadians. There is a tremendous amount of interest in vaccines around the world, and companies have choices. But we're going to make sure that Canadians get the safe vaccines that they need to get through this crisis. And we will continue to be transparent and open with Canadians about how we do that.
Hi, Prime Minister. Tom Perry with CBC. I'd like to ask you about the COVID Alert app. BC and Alberta have not signed on to it. Dr. Bonnie Henry out in BC yesterday was talking about they'd like to see some changes to better pinpoint when people were exposed to someone with the virus. Is it possible at this point to make those kinds of changes, or are you going to have to proceed with the app as is, but without BC?
We have, from the very beginning, put privacy at the top of mind in developing the COVID-19 app, because we know that that is something that matters deeply to Canadians. That if you have an app that does all the things that our scientists and doctors would love for the apps to do, not many Canadians would be likely to download it because of privacy concerns. And we've always had to try and find that balance right. And what we did was created an app that is totally private, totally anonymized, and totally voluntary by the user. We encourage people to make sure they plug in the code so that if they test positive, so that it can alert their contacts. But that is a voluntary choice that thousands upon thousands of Canadians have done and done their part. We're always looking for ways to improve it, and they're actually, we are looking at doing a better job of pinpointing moments of exposure and moments of testing so that the app can be even more accurate and it's not alerting people who were exposed well before someone tested, and that's a change that is very much in the works. And I hope that people in Alberta and BC who can right now download the app, but will only be notified if someone got tested in a different province and plugged in. I really hope that BC and Alberta listen to the many British Columbians and Albertans who would love to have this additional tool. It's not the panacea. It's not the one thing that's going to fix everything, but it is another important tool in our toolbox that has prevented thousands of cases across the country. And as we reach close to 5 million Canadians who've downloaded the app, close to a significant percentage of our population, I think it's close to 15%, we're at a place where it is having a real impact. And the more people around you have downloaded the app like you, the more you will be safe, which is why we're encouraging everyone to do it. But in the important trade-offs, we went with protecting people's privacy, protecting people's autonomy as the top desire. And even though certain, very thoughtful doctors and scientists would like to know more, we feel that having the largest number of Canadians comfortable downloading it and using it is the right utilization of this app. Different countries have done different things, but I think Canadians can.
Time you have for us today. Merci, Monsieur le Premier ministre. On va maintenant reprendre les questions dans la salle.
And now we will take questions in the room.
Minister Hussein, I had a few questions about the national housing strategy and when it comes to transparency. The NDP had data showing that most of the co-investment fund had not been spent. Most of it went to Ontario. The same HC will not provide any updated data until it comes out at an order paper question. The decision to prorogue Parliament put that on the back burner. You're announcing more funding allocations, but there seems to be a lack of transparency in how much of the existing allocations have actually been spent already. So I'm wondering if you're going to commit today to more transparency in how the funding is actually spent.
On the co-investment fund, it's a really key part of the national housing strategy. And I can tell you right off the bat that British Columbia has actually received 15% of the total investments under the national housing strategy, over $2.5 billion since 2017. So we have those numbers and we have released them. The assertion that somehow British Columbia has not received its fair share of co-investment dollars is actually not true. In fact, we've spent more than the allocation when you take into account BC's population with the rest of the country. We've invested more than that ratio in British Columbia, $2.5 billion. In terms of the overall other programs like the Rental Construction Financing Initiative and the innovation dollars, we announce projects publicly. We have reporting that is required under the National Housing Act to Parliament, that I have a duty to report to Parliament on an annual basis, and we do that. My predecessor did that as well. So I'm fully confident in our ability to not only flow dollars through the national housing strategy, different streams, but also to make those numbers public.
Just to clarify, I didn't mention BC, I just meant in general that there's not a lot of transparency around this stuff. And my follow-up question to you is about the National Housing Advocate. This was part of the legislation that was passed in June 2019. If this is a priority for your government, what's the holdup? It's been 16 months.
There is no holdup. We were doing, of course, we were going through a number of recommendations brought to us by different stakeholders of folks that they'd like to see in the council. Obviously, it wasn't just the advocate, it was also the National Housing Council that's supposed to work and help the advocate to implement ambitious targets in the national housing strategy. So that work is ongoing, but I'm happy to inform you that we're very much in the final stages of that work, and we will be unveiling the new National Housing Council as well as the advocate very shortly.
Bonjour, Monsieur Leblanc, collègue de mes...
Question. Minister Leblanc, a question on behalf of my colleagues in Alberta. Some bad news in the oil sector. 25% of Cenovus employees will lose their job after the merger with OSPI. Oil sector workers just keep getting hit with bad news and more bad news. How can you help them? What do you have to say that would reassure these workers? Answer, Minister Leblanc. I often discuss the oil sector, and my colleagues do as well, with the Albertan government. I have discussed this issue with my colleague Premier Kenny, I recognize how difficult things are for oil workers in Alberta. Things are also difficult these days for oil workers in Newfoundland and Labrador. We have announced and rolled out supports for this sector, but there are many problems to face. The oil sector is suffering and taking hits worldwide, not just in Alberta and in Newfoundland and Labrador. We reached a $1 billion deal to create jobs in Alberta. We can and will do more. We will work with Alberta and with its oil sector to help oil workers. Follow-up question. Question about the Atlantic bubble. A Halifax travel agency wants to enlarge the Halifax bubble to include some hotels in Cuba, so it'll be possible to visit these hotels and not have to quarantine. What do you think of this? Do you think it's a good idea to make the bubble bigger? Answer, Minister LeBlanc. I have spoken to my colleagues in Newfoundland and Labrador about this. When it comes to the Atlantic bubble, provincial governments of the region set up this bubble, which has clearly had a positive impact in public health. Now, there have been some repercussions, especially in travel and tourism, and when it comes to families being able to visit each other, especially with Christmas coming up. When it comes to traveling to Cuba, for example, public health authorities have clearly expressed that that's not the best idea, even with quarantine. Now, this suggestion might be one way to kickstart a sector, the tourism sector, that has really suffered, but it's not the best idea in the current context. Next question.
National Post, line open.
Yeah, hi. I guess this is best posed to Minister LeBlanc. I'm wondering, based on what we've seen in Parliament in the last week, the confidence vote last week, and then the vote on Health Committee last week, does the government still feel that this Parliament is functioning well, that it can continue to contribute, I guess?
Well, of course we do. Canadians expect parliamentarians in the Senate or in the House of Commons to work together in the context of the pandemic, of the economic and public health emergency that the country finds itself in. I've had the privilege of being in Parliament for almost 20 years, and if somebody had said to me that we would pass multi-billion-dollar pieces of legislation to support Canadians and Canadian businesses with the level of unanimity that we've seen over the last number of months, I wouldn't have believed it. So Parliament is absolutely working in a collaborative way. It's certainly what we want to do as a government, and it's what Canadians expect. So I'm confident, for example, that some of the measures the Minister of Finance and the Prime Minister announced a couple of weeks ago that require legislative enactments, I'm confident that we can work with opposition parties to put those in place quickly as well.
Following up, Ryan?
Yeah, and then just on the housing front, I'm wondering how many of these projects do you think could realistically be housing people this winter? Because I know there's concerns about congregate living settings being a place that COVID could spread, and certainly homeless shelters were part of that earlier in the year.
Very good question. Thank you. I want to take you back to April. We flowed $157.5 million additional dollars for the federal anti-homelessness program, which really went to over 62 communities and frontline organizations to combat that issue, and they were able to really successfully deploy those federal dollars to house people temporarily. So it worked. And we added another $237 million. And who can demonstrate, whether they're municipal governments or indigenous organizations or nonprofit organizations, it's going to go to folks who can demonstrate that they can turn that investment around and build rapid housing in a matter of months. And we expect, at least for the first stream, the major city stream, that they will be able to turn that into rapid housing before the winter. And I say that because they've already pre-identified properties, existing buildings that they can quickly convert to housing. We've also seen rapid improvements in modular housing where housing can be built in a matter of months. So I have full confidence that at least in the first stream that you will see a lot of housing being built before the winter, and for the second stream to be used before the end of 12 months. And that's exactly what the federal funding is supposed to go to. And it is in response to the Federation of Canadian Municipalities and other community organizations who've been calling on the federal government to provide them with the tools to acquire these properties to house people permanently.
Thank you, Minister. Operator, one last question on the phone, please.
Thank you. Merci. Next question, Jolson Lim, iPolitics. Line open.
Hi there. Thanks so much for taking our questions. First question for Minister LeBlanc. Many cities are still facing operating losses despite funds that have flown through the Safe Restart Agreement and from the provinces. Pandemic isn't going away soon. Is your government considering another financial package for municipalities?
No, at the moment we're not. We thought that it was an innovative and effective way in the Safe Restart Agreements to make these billions of dollars available in an unprecedented way to deal with operating losses of Canadian municipalities. As you know, municipalities are entirely under the jurisdiction of provincial governments. But mayors from big and small communities have talked to us about some of the enormous challenges they were facing, and their ability to raise revenues is obviously more limited than other orders of government. So that's why we put in place this matching funding where provinces also had to contribute, but the Government of Canada would contribute. We want to make sure all of that money is allocated and is available. But we're always willing to talk with provincial governments and municipal leaders that have real needs in their communities that aren't being met, because the challenge of not properly helping municipalities, I had this conversation with the mayor of Edmonton some weeks ago. They're providing frontline services to vulnerable people, amongst others, in their own communities. And you wouldn't want a situation in the context of the pandemic that these services were less available or somehow were diminished at a time when people need them most. So we'd be prepared to have an ongoing conversation, as we do with provincial governments and municipal leaders. But for the moment, our priority is to ensure that that money that was allocated in a total $19 billion initiative is available, is spent quickly to meet those needs. And if it's inadequate, we would pursue that conversation. But to my knowledge, provincial governments haven't come back to us and said that we need to find more money at this particular moment.
Following up, Mr. Lim.
And a question for Minister Sen. On the goal of ending chronic homelessness that you mentioned earlier, is there going to be a timeline or strategy going to be produced for it?
The strategy, parts of the strategy are already in place. A $55 billion national housing strategy that is continuing to build housing in all forms for all different kinds of populations. There is hardly a week that passes by where we're not making 1 or 2 or 3 housing announcements in other parts of the country. And then this rapid housing initiative is another piece of that strategy. But we will, of course, be looking at other ways in which we can ramp up our response to chronic homelessness in Canada. The opportunity is there as we build back better, and I think the fall economic statement will also be addressing that.
You're new. Hello, you got a question. Trudeau just now said that lockdowns worked in March, but that nobody wants that full lockdown now, but also nobody wants to be fighting COVID-19. Daily case counts now are higher than they were back in March, and deaths are rising, and fatigue is also setting in. Would a temporary lockdown like one that we saw in the spring help right now to flatten our rising curve, and would it potentially shorten the time that all of us are dealing with the impacts of the second wave?
Thank you very much for the question. You're right. I think what what we're seeing around the world, including obviously here in Canada as well, is that people are suffering from COVID fatigue. I think with the first wave, it was easy, as the Prime Minister said, it was a full lockdown. Everyone stay home, don't go to work, and we flattened the curve. But we want to get back to as normal as possible, sort of the functioning of society. And so what is that sweet spot, that balance in terms of accepting that there will be a certain level of activity of COVID-19, but not to the point that it overwhelms our public health and healthcare systems. And so I think that's the challenge in front of all of us here in Canada. And the other part I think that's important to note is that we are a big country. You know, the situation in the Northern Territories is different from the Atlantic bubble as compared to British Columbia, Ontario, and Quebec. And so I think the most important thing is that we need to follow what the epidemiology is at the local level and listen to what local public health officials say. So when we talk about be it temporary lockdowns or temporary measures that could or should be put in place, I would certainly defer to local officials. Having said that, I think I would go back to basic principles. I think that you know, the things we need to do, I think we've been repeating them, you know, even today again. And I would say, hey, it's straightforward. You know, it's the hand washing, it's the wearing of masks as it's appropriate. You know, stay home if you're sick. You know, physical distancing, all that's important. And also we, as a variation in English, we've been using the 3 C's, because certainly what we've seen in other countries and here in Canada is that if you looked at where outbreaks tend to occur, it's certainly in settings where, you know, it's crowded places, where there's lots of close contact, and I would say continuous prolonged contact, and also, where it's enclosed and you don't have good ventilation and so on. So, you know, all that comes into play. But as we just said this morning, the challenge is implementing it. And I think there's certain things that public health authorities and local government can do. But at the end of the day, it really comes down to what individual Canadians believe they could or should do. And I think a term that we might be using more and more is something called social cohesion. What is social cohesion? I think it's really the capacity of Canadians to collaborate and also to support one another. And support one another is in many different ways. It could be looking out for your family members, thinking what you need to do to protect your elderly parents or your loved ones who may have underlying medical conditions. It's looking out for your neighbors. Maybe you have a neighbor that, because of personal circumstances, it's harder for them to get out to do grocery shopping. So I think, as the Prime Minister said, I think we all need to sort of band together as Canadians. It's not going to be because a government decides to put a lockdown measure that we're going to get out of this. It really is all of us understanding what the tools are that we have at our disposal, including, you know, even the COVID alert app, and banding together and doing what we can on an individual basis.
Health officials said that Canada was at a tipping point. Since that warning, we've now topped 200,000 cases. We're about to hit 10,000 deaths today. Have we passed that tipping point, especially in the largest provinces, Ontario and Quebec?
It's difficult to say, you know, what a tipping point is. I think if you look at what's happening around the world, and I certainly, I think, look at what's happening in Europe, and I think it's obviously a cautionary tale. I think in many countries in Europe, look what's happening in France and Spain. Spain has sort of institutes of a national curfew and so on. The case counts per capita are higher than in Canada. So I think it's something we need to look at. I think at this point, to date, we have not overloaded, I think, at least the healthcare system. But you can see in certain parts of the country, we are starting to cancel elective surgeries because beds are being filled up by COVID-19 patients. So that certainly is concerning. We're also looking at the fact that in sort of long-term care facilities, elderly sort of residences, there are quite a number of outbreaks. Compared to the spring, the actual number of cases in those outbreaks are less, but it's still concerning. At least we know what we need to do. So I think it's a matter of implementing the right infection prevention control measures and getting on top of that. But I would say that it's a bit of a plea, I think, on behalf of, both the public health community and the healthcare system. You know, the doctors, the frontline workers, the essential workers, they're tired. Many of them are exhausted after what they went through in the spring. And I think it behooves all of us. We depend on them in our time of need if we become sick. And I think now they depend on us to do the right thing so that they don't even get further stressed by having patients come into the hospital. And even in public health, as I mentioned before, in the spring when we had lockdowns and cases came to light, when contact tracers for public health contacted these people and said, okay, who were you in contact for the past, let's say 2 weeks? People were able to mention, oh yes, 5, 6 people, I can count them on one hand. Now, unfortunately, what's happening is that when public health gets notified of cases, the number of contacts per case are 20, 30, 40s. It's unbelievable. It's certainly straining the capacity to do what we know is one of those priority activities, contact tracing. So I think at the end of the day, again, it all depends on individual Canadians. We all need to do our part.
Thank you. We have time for one last question.
Dr. New, it's another one for you. We've seen a number of media reports that we're not seeing a large number of outbreaks in schools in Canada or even in the United States. We've also seen studies that suggest kids are actually efficient spreaders. So I'm curious what data Canada is collecting, what research Canada is doing on this, and what you at this point can tell schools, can tell parents about how this virus is behaving in schools.
Excellent question. Certainly what I can say is that you've heard a number of times we've talked about the Special Advisory Committee, all the chief medical officers of health, along with Dr. Tam, myself. We have regular meetings every week, and certainly this has been one of the topics of discussion, exchanging our respective experiences, what's been happening in schools, and so on. At the present time, we all appreciate that what happens in schools is not sort of happening in its own bubble. It really is a reflection of what's happening in the local community. So, in communities where the transmission of the virus is low, then we certainly have seen that the quote transmission in the quote the school setting is also low. So I think it's not that the schools on their own that are going to be the main drivers of what's happening in the community. It's the other way around. From what we've seen in terms of the measures put in place by authorities across the different provinces and territories, by and large, they've worked. We certainly aren't surprised because, as I said, they are a reflection of the general community. And so individual cases have popped up and they've been dealt with. But I'm not personally aware of huge school outbreaks where there's been continued sustained transmission among individuals in the school setting. There have been a few cases that have been linked, but certainly local authorities have been on top of it and investigated, and as appropriate. And I know in BC they've even, I think, closed a number of schools depending on the local situation. So by and large, I think we all recognize that keeping schools open is one of the important things to do for children's their mental health, also for adults, parents who need to work. And I think we need to do everything we can to maintain our schools in terms of keeping them open and make sure that we focus on other quote areas where we can hopefully have a bigger impact in terms of stopping transmission.
And for Minister LeBlanc, now that both the motion last week to study We Charity failed and the Ethics Committee yesterday didn't seem to be successful, your government suggested that you would be willing to put forward a motion or have a study of We Charity. You had your own suggestions of how it would happen. Is your government still willing to do that, and if so, when?
My colleague, the House Leader, had offered publicly to have a committee of the House of Commons set up that would look at the whole issue of pandemic spending, where there were successes, where there may have been challenges, what lessons we could collectively learn. So that offer, of course, remains open. The House Leader, I know, is having conversations with some of his counterparts. If there's an agreement around that, that was something that we thought would be useful for Parliament. And it would, to your question, also allow other committees of the House of Commons to be seized of other issues that are properly before them, whether it's legislation or other policy studies. So it perhaps is a way to make some of the work more coherent as between different committees, to focus that particular effort on one committee. But of course, we're happy to continue to talk to the opposition about that. And my understanding also is in the Senate, the government representative, Senator Gold, was talking to his colleagues in the Senate about also having perhaps some structure in the Senate that could look at some of these issues as well. So that may become a reality in the Senate as well. I don't know where those conversations have gone, but again, the Senate is perfectly free to take up that issue as well.
Les élections partielles d'hier soir, êtes-vous...
The by-elections last night, do the results worry you? Yes, You won both by-elections, but your support dropped, and the Conservative Party seems to have quite a bit of support in Toronto. Answer: no, we're not at all worried. Quite the contrary. When our party wins 2 by-elections, that's cause for celebration. Imagine if we had lost one or both of the by-elections. This is still a victory. It is a victory. Now, by-elections are always different from general elections, especially when it comes to voter turnout. And this time it was even more challenging given that these by-elections took place during a pandemic. These 2 by-elections took place in Toronto. 2 extraordinary MPs were elected. This is excellent news for the Liberal Party, for the government. I feel very hopeful, and I will sleep very soundly tonight.
You get Louis to say en français, s'il vous plaît, and then Tom says in English. The Prime Minister answered that. Thank you.
Thank you. This is City Espresso.